so many people here in South Carolina that I know personally don't have health care. And if they do have something, it doesn't cover them adequately, and they always are looking for something better. The premiums continuously rise, and you're getting less for your money.
My mother passed away from ovarian cancer a little over a decade ago. In the last weeks of her life, when she was coming to grips with her own mortality and showing extraordinary courage just to get through each day, she was spending too much time worrying about whether her health insurance would cover her bills. So I know what it's like to see a loved one who's suffering, but also having to deal with a broken healthcare system. I know that pain is shared by millions of Americans.
So I'm really a pretty healthy person, but because of that one diagnosis, I'm, permanently uninsurable in this state. Health insurance companies won't even talk to me. I'd be willing to pay for my own private insurance. They won't take my money. So it's really frustrating because I work, I have a job, it just doesn't offer benefits. I'm a paralegal. I work hard, I pay my taxes, I try to live right, and that's what I get. No one will talk to me.
But I also work in the North Charleston community with a lot of the citizens who live right near industrial sources of pollution, and they are of lower income and are not insured, and they are dealing with heightened rates of cancer, respiratory illnesses, heart disease, and they don't have any way to pay for it. So it's the typical environmental justice issue where they're disproportionately carrying the burden for a lot of the industry around here, and then not covered with health insurance and going into the ER, or just not dealing with it at all because they can't afford it.
Right now it's very, very difficult. We're unable to afford that, and particularly myself, I cannot afford to pay health insurance to my employees because of the astronomical costs. And for that reason, I do lose good employees to other employers that are able to offer them that benefit. And that's very important in this day and age for people with children as well as their own conditions. And so we really need to be able to offer that and become competitive.
I've been trying to get health care, but every time I call, the health care, the money is higher and higher, payment is higher and higher, and I'm trying to get, the lowest thing I can so it's affordable to me, because it's good to have my health care, but I have to pay my bills too. Mortgage, car note, everything's going on. I said, I can't do this. I can't. I'm just going to have to sacrifice me, which is not a good thing, but I have to do it. And that's what I did. I just went without.
Thank God for Medicare. Medicare has held me together. I no longer worry about illnesses and worry, which has made me healthier. So I do encourage a universal system that is available to all.
A person like me that's self-employed, well, can't get insurance because it costs too much. If I take $200 and something a month to pay for my monthly expenses, then it takes all the money that comes in.
I have worked my entire life since I've been 14 years old. I have never been without insurance coverage, but I now see every year I'm paying more and more for my premiums, and less is covered, and every visit that I make to the doctor for anything as I get older costs me more and more and more, and now a larger percentage of my income is being spent on my health care.
So of course the insurance company says, well, that's a pre-existing condition, so there I was out of luck. I went back to the doctor, got an MRI, and it's still growing, and there's not a lot I can do with except get surgery. So since I went to the hospital, the doctor told me $18,000 just for his services.
We're dealing with a broken health system, and it's time for change. We can no longer continue with the status quo. As President Obama said, we need to do something to help families, and all families realize that they can have affordable health care insurance.
For me, my insurance is affordable, it's effective. I've had an ankle injury, I've had a gallbladder operation, And all of those were taken care of. I didn't have to wait. I got the medical care that I need. What puzzles me is why my friend who has her own business is paying upwards of $1,200 a month for their health care insurance.
I think it's vitally important that everyone has an opportunity to get affordable health care regardless of social background status, race, or any of those things affecting that. So it's personal to me because of the community in which I'm from, and I will do all in my power to help to make sure that we pass health care reform with President Obama's agenda.
This isn't about me. I have great health insurance, and so does every member of Congress. This debate is about the letters I read when I sit in the Oval Office every day, and the stories I hear at town hall meetings. This is about the woman in Colorado who paid $700 a month to her insurance company, only to find out that they wouldn't pay a dime for her cancer treatment, who had to use up her retirement funds to save her own life. This is about the middle-class college graduate from Maryland, whose health insurance expired when he changed jobs and woke up from the emergency surgery that he required with $10,000 worth of debt. This is about every family, every business, and every taxpayer who continues to shoulder the burden of a problem that Washington has failed to solve for decades.
My mom, who is suffered a stroke and had to wait a whole year before she could receive Medicare. I can't understand how someone who's worked all their lives has to wait to get health care.
I want to make sure that other individuals in our society, in South Carolina, in Mount Pleasant, in Charleston County, get the health care that they need so that they too can feel comfortable and live their lives daily and know that they're okay because they can depend on our community, our government, our president to help them to get the medical care that they need. And I thank you.
It's good to have my health care, but I have to pay my bills too. Mortgage, car note, you know, everything's going on. I said, I can't do this. I can't. I'm just going to have to sacrifice me, which is not a good thing, but I have to do it.